Now.
On 105.9 FM and streaming worldwide on the WMAL app.
O'Connor and Company.
It is 8:36 on O'Connor and Company. Coming up in 30 minutes, it's the Chris Plant Show. Good Martin Luther King Day to you, and also good first day of snow in a couple of years. So we're going to continue to update you on the roads and the conditions if you're out and about with Jamie Whitten every 10 minutes. First on the fives. Also, it's Iowa Caucus Day. Julie Gunlock, this just in. Early returns in the Iowa caucus. Projected winner, according to MSNBC, Stacey Abrams. Stacey Abrams will win the... And if, by the way, if that doesn't turn out, there has been some sort of malfeasance and voter fraud there. But we'll keep an eye on that story, too. Joining us right now is our friend Dr. Marty Makary. He, of course, a professor at Johns Hopkins and an outspoken, rational human being when it comes to infectious diseases and public health policy. Thanks for joining us. Happy New Year, Dr. Makary.
Happy New Year. Good to be with you guys. Thanks.
So I live in Maryland, and I've been going to a couple of doctor's appointments now and again, like physical therapy stuff, orthopedic stuff, masks everywhere. Everyone, in fact, in Annapolis, at the hospital I go to, at the medical center I go to, it is the mandate that everyone there must wear masks. Is it because of a new variant? Is it because of the flu? What's going on here?
Well, the seasonal viruses are circulating. The CDC itself has said this is not atypical for a normal virus season in the winter. We're not seeing more infections or more hospitalizations than we would any flu season before COVID. But hospitals want to feel like they're telling you to do something, and it's a little bit of a political badge. You know, we stand by our mask policies of the past, so we're going to bring them back right now.
What have you heard about? We know that some medical facilities are insisting on this, like Larry just said. But what are you hearing from about schools? Because we know schools were very reluctant to lift the mask mandates, and probably looking for any excuse to put them back on. So, are you hearing about that?
I have not heard about masks coming back in schools or that discussion. I think people are very concerned who are making these policies about public perception, and most people in the public feel like they've been lied to about the masks and lied to about the 6 feet distancing and a lot of other things. You know, the mask question has been studied, and it was studied extensively and published in the highest authoritative body in all of medicine called the Cochrane Review.
Yeah.
And they said that there was no benefit to community masking. You can have a short-term benefit in a 20-minute interaction. If you're wearing a tight-fitting N95, yes, in that brief interaction, you can slightly reduce the risk of infection, but nobody does that. It's not possible. People are wearing cloth masks and their noses are hanging out. And on a broad level, community masking failed in the big studies.
Well, and in fact, there's a new study out in November out of Norway, peer-reviewed study that was published in the Journal of Epidemiology and Infection that says that there was a higher incidence of COVID-19 among those who were consistently wearing masks. So between that and, as you mentioned, the social distancing, we've been reporting that Anthony Fauci now has said that he has no idea where the whole social distancing 6-foot rule came from in the first place. This is a crisis not of public health, but of confidence in public health officials, Dr. Makary. And I don't see anybody at the CDC or at the federal level or even at the state level that's taking it seriously. Because when there is truly an epidemic coming down the road, we're going to need to have confidence in our public health officials, sir, and we don't.
And there's no confidence right now, and that's why we're seeing a measles outbreak right now in Philadelphia. People have lost confidence, and it's sad because I'm proud of the medical profession. I love being a doctor. But I'll tell you, I was seeing a patient this week, and I was talking to them in clinic. Of course, they're wearing a mask. I'm not wearing a mask, but they're wearing a mask. And I start offering different options. These are serious issues we're talking about, serious health issues. And when I offer something to a patient, something that's invasive, I want to see their reaction on their face. It's not they're in a sort of borderline situation if they need it. I need that human connection. I need to see their face and how they feel about having something major done. And I can't because I can't see their face. So I had to ask him, can you remove that mask so we can have a human-to-human conversation for a few minutes? Is that okay with you?
Uh-huh.
How do we explain to people? How do we get back to reasonableness and common sense among those people? I mean, what do you advise them beyond that appointment? Do you talk to them about the masking? What can, individual medical professionals do to try to get people to sort of, I don't know, see reason on this issue?
It's hard, Julie, because COVID is one of those issues where people are so dug in. It's become tribal. And most people are reasonable, but they're afraid to speak up, or they're just saying, I stand with this guy, so therefore I'm doing this. But if you look at the amount of anger that's still out there, it's unbelievable. Now, I kind of believe in forgiveness, but look at the anger that is still out there against people who don't mask, people who don't get the latest fifth COVID vaccine, people who don't think natural immunity was real. They're angry at everybody. They're blaming them. They're angry. And they're angry at the world, everyone except the people who brewed this up in the lab in Wuhan. For them, it doesn't matter. It doesn't. Who cares?
And I will say also, Doctor, there's anger on the other side. I consider myself one of those people because of my children and how they suffered during COVID. And you had a writer saying, amnesty. And you have Fauci, who just recently said, he doesn't really think there was a lot of learning loss. There's never been an apology, right? Or any kind of indication to parents or to, regular folks that this won't happen again. And that's the nerve. I think that's where the anxiety comes in, that I'm not confident that they wouldn't do exactly the same thing. So I'm all for forgiveness too, but I think the request for forgiveness should come first.
Right.
Yeah.
Yeah,
absolutely.
Funny thing about forgiveness is that it's oftentimes, from most people, provided as soon as it's asked for.
Yeah.
As soon as contrition is actually shown first, and that's why Dr. Makary, we appreciate you being a straight shooter on this thing from the beginning. And I know that your biggest concern here is, again, the faith in our public health institutions, because we do need – I'm not an anarchist. There is a role for government in things like this, but it needs to be free of politics. Maybe I'm being naive, but I guess in our final moments here, since we're in the middle of a new election cycle with a new president, what should be done on the federal level to restore that confidence?
Well, I hope that the new health officials that come in, if we get a sort of fresh batch of folks, are going to start with humility and an apology, and let the public know that if we don't know the answer to a question, we're going to tell you, I don't know. We're not going to make something up, because when we make stuff up in medicine, in modern medicine, if you look at the last 20 and 30 years of modern medicine, when we just make something up and rule by opinion, we have a lousy track record. When we use science, we shine as a profession. But when we make stuff up about the low-fat diet, or opioids are not addictive, or hormone therapy causes breast cancer, it does not cause breast cancer, or kids should avoid peanuts to prevent peanut allergies, the American Academy of Pediatrics got that backwards. I'm writing a book now going through the track record of modern medicine on the giant recommendations it issues. And the theme is, when we use science, we do well. When we rule by opinion and make stuff up, we have a terrible track record.
That's great. Can't wait to see that. Dr. Marty Makary, Johns Hopkins, thanks for joining us, sir. And, the other part of that is when they made stuff up, or when they just outright lied, and then if you dare to challenge it and question it, you were beaten over the head and told that you were anti-science and that you were a Neanderthal and you were going to get people killed, even though what they were proposing was wrong, was a lie, was made up. There's a whole lot that still needs to be repaired there. It's 8:45, WMAL traffic and weather every